Hi, my name is Claire. This is my Sports Medicine 3, Project 4 on Rehab for UCL Reconstruction. What is the UCL? The UCL is a ligament that connects the ulna to the humerus on the medial side of the arm while the hands are in supination. In the picture to the left, we can see the two bones and then the UCL connecting them together. What is UCL reconstruction? Ulnar collateral ligament reconstruction, also known as Tommy John surgery, is a surgery that is needed when the UCL has a complete or partial tear to the ligament. Full tears to the UCL will need surgery. Partial tears you can complete with non-surgical treatment to recover. We can determine a tear when completing a valgus test to the UCL. What is a partial tear? A partial tear is a slight tear in the UCL that has not advanced to a full or grade 3 tear. What is a complete UCL tear? A complete tear to the UCL happens when a partial tear is not treated, therefore it tears completely. How long does UCL rehab take? After the completion of the UCL reconstruction surgery, you will be able to start the rehab process. First, for rehab, you can expect to get back into your daily life with range of motion at about 4 months. Next, at about 6 months, you can start to do small throwing progression while wearing a brace. Next, at about 8 to 9 months, you can expect to be back to throwing at the pitching distance without maximum velocity while wearing the same brace as before. Finally, anywhere from 9 to 12 months, depending on the patient, you can expect to be back and fully recovered at anywhere from 9 to 12 months. Next, we will move on to the rehab process. Phase 1, immediate post-op, 0 to 3 weeks after surgery. Goals: 1. Reduce pain and inflammation. 2. Protect graft site. 3. Protect healing tissue. Intervention: 1. Ice and compression. 2. Soft tissue mobilization. 3. Week 1, 90-degree elbow flexion brace. 4. Week 2, hinge brace 25 to 100 degrees. 5. Week 3, hinge brace 15 to 115 degrees. Next, isometrics. Load for exercises. 1. Wrist active range of motion. 2. Elbow passive range of motion. 3. Shoulder active range of motion. 4. Forearm strength. Criteria for progression: elbow range of motion at least 15 to 115 degrees. Next, 2. At least a 4 out of 5 on the MMT, manual muscle test. Phase 2, protection phase, 4 to 6 weeks after surgery. Goals: increase to full range of motion by week 6. Promote healing of repaired tissue. Restore full function of graft site. Intervention as needed: ice and compression, elbow passive range of motion, no valgus stress to the elbow, soft tissue therapy. Strengthening: wrist and forearm strength, bicep and tricep strength, lightweight, light resistance band training for elbow and shoulder. Criteria to progression: 1. Full range of motion, good tolerance to all exercises with no pain, 70% strength in forearm and shoulder in uninjured arm. Phase 3, strength phase, 6 to 12 weeks after surgery. Goals: increase strength, endurance, and power. Maintain full elbow range of motion, mainly extension. Intervention as needed. Maintain full elbow range of motion. No throwing. No valgus stress to the elbow. Soft tissue mobilizations. Strengthening: forearm strength, flexion and pronation. Elbow strength, eccentric flexion and extension. Manual resistance for arm. Rhythmic stabilization for arm. Throwers 10 program from weeks 8 to 9. Criteria for progress: maintain full range of motion, pain-free. Good tolerance to exercises, pain-free. 85% strength as uninjured arm. Phase 4, advanced strengthening phase, 12 to 16 weeks after surgery. Goals: progress in power and endurance. Initiate sports, functional movements. Get back to normal forearm and shoulder strength. Intervention as needed. Keep pain to a minimum and reduce swelling if there is any. Strengthening: week 12 plyometrics, 2 hand drills. Week 14 plyometric 2 hand drills away from body. 3. Begin 1 arm plyometrics. Criteria for progression: painless elbow, wrist, and shoulder range of motion. Injured arm has same range of motion 5 degrees or less of uninjured arm. Functional test score of 90 to 100%. Satisfactory score on KJOC thrower's assessment. Physician clearance. Phase 5, after 16 weeks. Goals: initiate sport-specific training program, safely progress to full sport, intervention as needed, interval throwing program. Sport-specific return to sport protocol and throwing protocol is needed. Once again, my name is Clay Orr. This is my Sports Medicine 3, Project 4 for Rehab for the UCL Reconstruction. Thank you for watching.